Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet with our Jerry Garcia ties.
Right, right. In our opinion,
In our
of course.
opinion.
What's up, Bob?
Well, I thought we'd just give a little tip today for treating knee pain.
Sure.
And when this works, it works great. If it doesn't work, it just doesn't work. But it's especially if you have, I've had good luck with it with people who have arthritis.
Sure.
It may work with other types of knee pain. I really don't know if I've tried it with other things.
So this knee pain is associated with walking, with sitting, what?
Yeah, often with stairs or anything that involves bending the knee,
Okay.
like squatting
Sure.
or getting up from the chair. And generally what you're finding is that you're having trouble bending the knee because it causes increased pain. Do you mind throwing that one or getting me the knee model?
Oh, you want the knee?
Yeah.
Yeah, I'll throw it. There you go.
Why, what a wise guy. Okay, so this is my right knee. And what I wanted to show you, and I don't know if you can pick this out or not.
Just so you know, this doesn't stick out on your knee.
Yeah.
This is a model, that's the tendon that needs to be down there. So just remember that's down, but we're gonna leave it flip up
We
for now.
detached it so you can show anything's better. But a lot of people think the knee is very simple, that it's just a hinged joint like this. And actually what's going on though, on the tibia, the lower bone here, there actually is some turning going on.
Right.
And so when you straighten the knee is actually turning out. The tibia is turning out.
Yep, external rotation there.
And when you bend the knee, it's actually turning in. So, oops, turning in. I had it the wrong way. So when I bend the knee, the bone's turning in, and when I straighten the knee, the bone is turning out. And that's why that little, what we call accessory movement, is very important. And that a lot of times if you reestablish that, it helps take away the pain. So this is very simple. Let's just keep it simple here. If you're having pain, and this is going to be your test, I'm having right knee pain. I put my foot up on a chair like this and I bend forward like this, taking some weight on the leg, and it starts to hurt. That's appropriate then to try this technique.
Sure.
Okay? Especially if your knee doesn't bend as far as the other knee. Like if you have one good knee and one bad knee, and this knee is kind of restricted, doesn't go as far, this is a good thing to try.
Okay.
Okay?
So
I'm gonna go ahead and roll the little pant leg up here. And again, this is the lower tibia here. And when I'm grabbing right behind the tibia here, I got my palm right here, my palm right here. Okay? And I'm actually gonna turn the bone. I'm really grabbing on hard and turning the bone. And then while I turn it, I'm leaning forward like this. 1, 2. So you turn it in toward the middle.
so rotating it.
Yeah,
So
rotating it.
obviously the bone is here, the tibia bone is here, but you can't get a hold of it because you have all this flesh around it, muscle. So Bob is just trying to.
Yeah, I'm using my palm, grabbing way back here, and really trying to turn it.
Yeah.
And that accessory movement often helps decrease the pain. If it doesn't decrease the pain, if it still hurts, this isn't right for you. It actually should decrease the pain when you're bending it.
So the first time you do this technique and you start to bend and rotate, it should be easier to bend with less pain.
Exactly.
If that doesn't happen,
Make sure though you're turning the leg before you bend it. Don't start bending and then turn. You gotta first grab it, turn it, and now bend. So let's say it's the other leg, just so that you know.
sure.
This one, I would take it and I would turn it this way, again, toward the other leg, I guess is
Sure.
the way to say it. So again, I'm going to take it, turn it, and then I'm going to bend it. Look at that, cracking.
Oh yeah, get the cupping out.
Yeah.
So where did you get this technique from? Did you?
This
think
is
of it?
Brian Mulligan. He's a famous therapist from New Zealand, world famous. He's got a lot of techniques like this for self-treatment, and he always says that if you do things right, you should see a miracle a day in the clinic.
If you practice these techniques.
These manual techniques, and I have to say, quite often, I wouldn't say it's been every day, but quite often I experience a miracle using his techniques where someone's got something that they've had for years and all of a sudden it got better. Again, I've had best luck with this one, with the knee one, with people who have arthritis.
Sure.
So,
Yeah, Mulligan, he's quite the guy.
yeah,
You can Google him and
he's a character.
He's about 80 years old now, isn't he?
I would say at
Yeah.
least. I always laugh because he's got the name Mulligan, which is, of course, relates to golf. And I hear on golf, he's very impatient. So, and he tries to do rounds like, within less than an hour, he tries to do 9 holes. He's
Yeah.
he's really fast. He's really fast.
That's the way I'd like to do. Yeah, we saw him in person.
Yeah, we saw him in person.
A few years ago up in the cities.
Yeah.
Yeah, he's the only instructor that I ever saw that had a beer for lunch
Yeah.
in front of all the students and went back to work.
He didn't care. He was a great instructor.
You get to that age, you can do what you want.
Yeah, a lot of enthusiasm, so.
Yeah, I don't think he works on hearts either, so, no broken
Oh,
heart.
that's right. We can fix just about anything, but we can't fix
A broken
a
heart.
broken heart.
I